Hey, welcome back to another episode of Tech Talk. I'm your host, Jeff Hootselle, Chief Cloud Officer with Auditmacs. Hey, as you guys know, Tech Talk is a show we interview IT leaders and subject matter experts in the technology space. We talk about current events, we talk about trending topics in that space, and a lot of these amazing companies that are doing really unique things in this environment and people that are leading those organizations. We've always got great guests that join us. Today is no different. We've got Isaiah Nathaniel. Isaiah is the CIO with Delaware Valley Community Health. Got him joining us today from Philadelphia, Pennsylvania. So Isaiah, welcome to the show.
Thanks for having me. I appreciate it.
Yeah, it's great. Great to have you. Glad to see things are getting bright and sunny out in Philly now. You guys are getting out of the cold weather a little bit?
Well, we're at least able to see the sun at this point, with the current pandemic and things that are going on. We can look out the window and see it. But for healthcare, which I work, I have been going in every day. So it's a nice change.
That's great. Well, so Isaiah, maybe from the beginning, talk to us a little bit about Delaware Valley Community Health and kind of what you guys are all about, who you serve in the marketplace, and maybe what makes you guys unique.
Yeah, so Delaware Valley Community Health is a 50-year-old organization where our mission is to serve the underserved regardless of their ability to pay, regardless of their socioeconomic status. We will see you. Where you fall into the healthcare category of federally qualified health center. And for those that don't know what that means, is that we received 330B grant from HRSA that will allow us to continue to operate. Although that is a good number for us to operate on, that is not the full balanced budget, but that was categorized as a FQHC.
That's great. So obviously being in the field of healthcare, there's a lot of relevant things we can talk about, things going on. And we appreciate organizations like yours. You mentioned you're kind of serving the underserved, which is really essential right now. I'm curious from your perspective, Isaiah, as you look at everything that's happening in the healthcare space, even before kind of the COVID-19 situation, there was a big transformation kind of happening in the world of healthcare, and especially with healthcare IT. Talk to me a little bit about what that's been like in your world, and what you guys have seen from that transformation standpoint.
So I'll try to tackle that in a few different legs for you. And Delaware Valley Community Health, we see on average annually about 50,000 patients, and that turns into us for about 150,000 visits per year. Our primary care service lines are internal medicine, adult medicine, behavioral health, mental health, dentistry, pediatrics, OBGYN, and women's health. Those are the service lines, and we have 8 locations in the region. And we have about 310 employees. So the state of healthcare prior to the pandemic was serving that community. Soon as the pandemic hit, it was serving that community, but in addition to that, serving the 310 employees that we have as an organization. So at that point, that's where my job really kicked into high gear. And we had to, over a weekend, because it hit us like everyone else on that weekend of March 16th, I would never forget it, we had to make a complete shift. We had to shift not only our workforce, but we had to shift our patient population to telehealth. We had to shift our workforce to telework. So all of these tele things happened in a matter of a weekend. And if we weren't able to handle that with the systems that we had in place, I wouldn't have a job today.
Yeah, so telehealth, obviously it's a big movement to begin with, but now it's almost essential that you have to have that. As you guys have made that migration and looked at it, what are some of the aspects that you've had to kind of look at and examine in rolling out really an effective telehealth strategy?
I think it's twofold. I think it's the patients, and then I think it's the providers. One, you have to make sure that the patients are capable of having these visits. So we use our clinical team. We use our clinical care coordinators. We use some of our front desk, our MAs, some of the operational staff to make sure that we at least speak to the patients prior to their visits to make sure that they can have the proper patient experience that we want them to have. We don't want to degrade service in the middle of the pandemic. We actually want to excel in it. And then from the provider perspective, we just wanted to train them, make sure they understood what the video and audio capabilities were. And then from a systems perspective, it's my job to make sure that it worked at the point of care. There were no drop packets, there were no lag, that our WAN was intact. So that is when you couple all of those things together, that is why we at Delaware Valley Community Health are so pleased that we're able to make pivots in such a crucial time.
Yeah, and I know you guys have mentioned you've really focused a lot on that user experience, right? So for a lot of people, this is the first time they've ever even experimented or tinkered around with telehealth. and it's not, they're doing it for, it's really at a critical time when their fears are high. They may have true medical issues. They may have things non-related to COVID that they're just not comfortable with coming into an office. From that user experience standpoint, what have you guys experienced? Have people really embraced it and adopted it? Do you think people are surprised at kind of the ease it is of doing telemedicine versus the traditional methods? Or what has that kind of feedback been like?
So being in an urban space for community health, the challenge really wasn't the technology for us as an organization. It was more about the reimbursement structure. And telehealth wasn't really reimbursed at the high efficiency rate that our normal rate for service would be if someone were to come into the office. So once the pandemic hit and Congress and our state legislators and our government representatives really reduced those restrictions, we were able to make a quick switch and say, hey, now we can do telehealth. One staggering statistic that I want to share with you is that in the month of March, where this COVID-19 virus was at its peak, we didn't allow anyone into our offices. If there wasn't truly an emergency, you could not come into our buildings for the safety of both the patients and our staff. So on a typical monthly budget, we budget based on productivity. We want to see between 3,200 and 3,500 visits across all specialties. Now, during the pandemic, we're not servicing optometry patients. We're not servicing dental patients. So we don't have those two service lines. But guess what? Because of the systems that we have, because of our patients trusting us, we were able to see 2,600 patients in that time of month of March. That is a staggering statistic, and all of that was through telehealth. So when you look at it from a legislative perspective, it can be done in the urban market, and we have the stats to show it.
That's fantastic. Well, and a lot of the folks in the healthcare space that we're talking to as well is, you would think, you've seen the news, these hospitals are overwhelmed and they're very busy and with all the cases coming in. But, in fact, a lot of the organizations are having to lay off folks during this time because you said just the normal practices are not seeing the frequency and the number of visits they've had. How has that impacted you guys from a staffing perspective? Have you guys seen those, had a reduction in staff and things like that associated with this pandemic?
One of the things I am very, very proud for our organization is that throughout this time, we have not laid off not one worker, and that's 310 employees. And in fact, we have actually added 2 additional employees to our payroll.
That's great.
So we are very, very happy to be able to do that. And, as a CIO, that makes me smile. That makes me sleep a little better at night because I know it's because of the system. Outside of the CEO, the top 2 most important executives in the organizations, any healthcare organizations right now, is the chief medical officer and then the chief information officer. So I'm very proud of the work that Delaware Valley Community Health is doing. I'm excellently proud that our clinicians are able to do their job. And I'm very happy that me and my staff have been able to give them those tools that make them successful.
That's great, Isaiah. And you can tell just from talking to you kind of the passion you have for the company and the organization and the fact that you guys are that, focused on the culture of taking care of your employees. Obviously, that's going to extend itself and trickle down to the patients as well. So that's a great thing. So the last question I have for you, we've talked to a lot of the different CIOs, about this pandemic and all of the challenges they've had with this and having to, you mentioned that March 16 date of having to shift everybody from home. And all the other things that have disrupted your business. As you kind of look down the road from this, as we're starting to hopefully, go into that next phase of it or hopefully come out of this, what do you think the lasting positive things that'll come from COVID will look like? Some of the legacy there of good things that'll come out of this situation.
That's a great question. And I sat back a little bit because it brings out the morale in me. And the morale in me is saying that we found our new normal. And in addition to that, we also found that we are stronger together as a healthcare industry. Sometimes we're fragmented. The statistics show it, the articles show it. We're a fragmented healthcare system. But one thing that this time has shown all of us is that we can work together. We shall work together and we shall get over this. That's the little Baptist preacher I have in me, but that's it.
That was great. You got a fallback position if the CIO thing doesn't work out. I can sense it.
How about that?
Yeah. Well, Isaiah, hey, thank you so much for coming on, chatting about it. I know Delaware Valley Community Health, it sounds like a great organization. You guys are doing great things, and they're lucky to have somebody like you leading from the top there. So we appreciate your insights, and thanks for coming on the show.
Thanks for having me, Jeff.
You got it. Hey, and thank you guys for joining us as well. We appreciate you tuning in every week. We're thankful to all our guests, and we hope you guys stay safe out there. We'll talk to you soon.